Good morning, everyone. This is Chuck Prosper, Chief Executive for the Northwest Network. Thank you very much for joining us in our regular series of Caregiver Town Halls. It's wonderful to see the group that we have already, and I expect that to continue to grow as more participants join. Please take the moment to open up the chat function in your meetings application so that we can receive any questions that you might have for our subject matter experts today. Today's meeting is also going to be recorded so that other caregivers who are not able to attend today can be able to benefit from the information that we share. But before we get into the full meeting, what I'd like to do is to ask Elliot Quita, our Chief Operating Officer for the Northwest Network, to start us off with a reflection. Elliot.
Thank you, Chuck, and good morning, everybody.
Elliot, you went back on mute.
Thank you, Rosanna. Sorry, everybody. First of all, I wanted to just let everybody know, I know we've been going through some just unprecedented times here in healthcare, and particularly here in our Northwest Network. We've got several of our communities that are very busy and not necessarily just with COVID patients. So I wanted to acknowledge all of the excellent work, teamwork, and collaboration that's been happening across our network for a very long period of time, but it's really picked up over the last several weeks. When I think about the work that everybody's doing, one of the words that comes to mind for me is the word resilience. And I think right now, everybody who works in our space needs to have some resilience. And so I came across some words that I had heard some time ago, and I share this reflection with you. At the epicenter of a storm, it is always calm. Find that center, your center. That's where you will find strength. So I hope that everybody does find that center of the storm that we're in right now and take a few deep breaths, recognize the excellent work you're doing, and most importantly, the patients that we're taking care of. So Chuck, back to you.
Thanks, Elliot. And speaking of storms, why don't you just stay on for another moment longer? We've been working through our orientation process and really ensuring that Elliot's had the opportunity to visit all of our communities in the Northwest Network. I personally have been unable to go to Ketchikan for about the past 14 months during the COVID travel restrictions. But Elliot and I went to Ketchikan just a week ago, and we actually had a nice duration of some nice weather without a whole lot of rain. But I think we had just missed a very stormy week the preceding week. Elliot, I'd be curious to know what some of your first impressions were of the Ketchikan community.
Sure. Well, it was a great trip, and what a beautiful setting. And as I've had this opportunity now, Ketchikan was the last community visit in our network. And so I was thrilled to make it up there. The hospitality of the team there, Dory, Hill, Lisa, Shayna, the whole group was just fabulous. I have a better orientation now of the layout of the building. And so hopefully the next time I get back, I'll be able to find my way a little bit better without always having to have Chuck as our chief executive taking me through from places here to here. So it was a beautiful setting. And so I'm really looking forward to getting back sometime this summer to see our team members there. So thanks for asking, Chuck.
Thank you, Elliot. All right. Well, and part of our rounding as leaders is really being able to listen and to better understand from the various caregivers across the network what's important to you. We also have a formal process through that using the Caregiver Engagement Survey. And so that while that was done several months ago, the work has actually grown in terms of activity and intensity. And so I'm going to ask leaders from each of our 4 communities to give an update on what we've done recently with respect to the Caregiver Engagement Survey and some of the tools that we've employed and lessons learned. What I'd like to do first is to start with Jack Estrada, our Chief Administrative Officer for Peace Island Medical Center. Jack.
Thank you, Chuck. Excuse me. Welcome, everybody. Appreciate it. You all taking the time to be on our caregiver virtual town hall. And I want to first start with thanking everybody for their all work this past year, but especially it was so much fun to celebrate Nurses Week and Caregiver Week this past couple of weeks, and we had a lot of fun out at Peace Island. We had an ice cream truck, so to speak. It was really leaders taking ice cream around in a cart complete with ice cream truck music, and so that really livened things up a little bit, and we had a lot of fun. And we distributed some small plants and journals to our nurses, and had the requisite meals and treats, as as we've all come accustomed to, and we had a lot of fun. So that was great. But one of the things that we've learned through our caregiver engagement and our sensing sessions and such is that obviously safety is at the top of the list. And some of the things that we've done in response to the inquiries that we've gotten, we're in the process of improving our lighting outside so that our pathways are better lit for caregivers when they come into the building. That's about halfway done. We also are putting some safety delayed doors in our emergency room so that we delay patients and or caregivers or anybody from leaving the building too fast and just bolting out and or coming in quickly, so that caregivers have time to respond to any sort of emergencies. We also have installed and completed the installation of security cameras in the emergency room and the emergency room lobby, so that our PARs out at the desk feel like somebody can see them, because they sit outside of the ER doors without anybody being able to see them. So they felt very unsafe. And so that's been completed as well. And I think that was a huge improvement. And as far as communicating and connecting with our caregivers, the leaders, myself and our other two administrators, have made a conscious effort to attend both the clinic and the hospital DMS meetings, so that we really hear from all the caregivers throughout the entire building and make those connections and marry up the two towards better communication and hearing what they have to say live. So that's just a few things, Chuck.
Thanks a lot, Jack. Really appreciate it. And for our next report, I'd like to ask Chris Johnson from United General to provide an update from that community. Good morning, Chris.
Morning, Chuck. Thank you. First of all, I'd just like to say that through the sensing sessions and the caregiver engagement workshops, I'm just really grateful to all the individuals that participated in it. When we just had the caregiver survey, we had kind of some line items, but we were able to put some teeth into some verbal language into the specifics of what that meant in the caregiver survey. So for me, it's been very enlightening to kind of hear the topics that evolved through those sessions. So a couple of the ones, as kind of mentioned before, security is a huge focus. Our caregivers really talked about the entry points to the hospital, specifically like our patient registration staff and the access that they have to people just walking through the doors, and talked about how do we protect them more, like with panic buttons or shielding or some other tools that we might be able to utilize. We talked about our EDs in particular and the security around just the evolving nature of the patients that we're seeing, and that we need to take care of our caregivers there. We also talked, interestingly enough, about drilled preparedness, and what do we do if there's an active shooter? What do we do if there's a power outage? How do we handle those situations, like in our parking lots, maybe dark or something like that? So that was definitely an area of focus. Community certainly came up. We're looking at having some community-specific town halls at UGMC to kind of hear more directly from our frontline caregivers. But we also realize that some of the tools that we may be using right now, that we need to kind of revamp and relook at, and really listen to what our caregivers are saying when we're rounding, and hear that, and pull that information, as always pushing the information out. And the last thing I would mention on the surveys is that we clearly heard from our frontline with a concern for our patients around scheduling. So we realize that we have some processes that are broken that we need to reevaluate, and we need to stand them up in a way that will be helpful for our patients in getting in on a timely manner to see to get the services that they need and not have to go to other sites to make that happen. And lastly, Chuck, I just want to mention, Elliot mentioned about the tremendous workload that we've been seeing recently, and it's really difficult right now to kind of look at prior year, because prior year was the middle of COVID, and compare where our volumes are at. So I went and took a look back at December of last year to date, and current year to date. And what I found is that in our HCU, our acute care unit, we're up 12.5%. Our acute rehab is up 15%. Our OR is up an incredible 52%. And then some of the ancillary departments like DEI are up 13%, and lab is up 8.5%, and pharmacy is up 15%. All to say, not only have we hit pre-COVID volumes, but we're now starting to grow and exceed those targets that we had just 14, 15 months ago. So incredible job to our community. Really thankful for all the input they've given us through the surveys and the work that they're doing. Thank you.
Chris, thanks very much for that update, and congratulations on the growth and success at United General. A lot of that also wouldn't be possible without the really close and aligned partnership with the Peace Health Medical Group, creating a tremendous amount of access for patients in the Sedro-Woolley community in the Sedro-Woolley Clinic. So, of course, a great shout out to the Peace Health Medical Group. Thank you. The next group that I'd like to hear from is Ketchikan, and I believe we have Shanna Griscola and Hill Pettis, who can give us an update on our caregiver experience from Ketchikan. Hill and Shanna.
Yes, thank you. My name is Hill Pettis, and these sensing sessions were extremely important to us because there were some surprising revelations that came out of those. So the day after that, Dory and I immediately started discussing those and trying to begin to brainstorm how we're going to address some of those things were brought up, because those are taken very seriously by both her and I. And we were able to get that feedback from our sensing sessions here at staff meetings, our Pathway to Excellence Committee, our RNCC meeting, which is a meeting between our labor partners and leadership and management. But one of the biggest accomplishments that we had here during the pandemic was obtaining our Pathway to Excellence designation. And when we submitted our original document in February, we were trying to decide if we were going to go ahead and go forward with the survey because the COVID outbreak had already occurred, but we decided that we needed to do that and just get it done. So I'm so thankful that we did that, and so pleased that we're able to accomplish Pathway to Excellence here. And we're going to be going, hopefully, to Atlanta in November to celebrate those accomplishments at the Pathway and Magnet Conference. As far as finance, our outpatient procedures have increased and continue to increase, and then our surgical volumes have increased over this last year, with an additional challenge of having our COVID unit cordoned off in a portion of pre-op and using those pre-op beds. So the OR has really performed out in an outstanding way. Another thing that we're working on right now is our Anti-Microbial Stewardship Center of Excellence, and we're partnering with our pharmacy colleagues. There's some education that the pharmacists have to obtain, and we then have to secure our ID doctor in partnership. So that's something that we're looking forward to accomplishing, hopefully by the end of the year, and are very excited about that. We conducted a security assessment because the ED had some concerns, and we identified many actionable items. We've probably accomplished or finished about 90 to 95% of those. So we're on our way to helping provide an increased sense of security for all of our staff, but most importantly, our ED staff. We just recently implemented a WICKLS program, and that's a wooden nickel, and it's a rewards and recognition program where when staff demonstrate actions that are in line with our mission, vision, and values, they are awarded wooden nickels. And then once a month, we're probably going to start that in July, we'll open our WICKLS store, and they can purchase branded items with their WICKLS that they have accumulated. Finally, as far as what we're doing for community, we are working on a process to finalize to be able to administer monoclonal antibodies therapy in the ED. And so we're excited about that. And then in addition, we have begun to work on a process and are about halfway or so through with that as far as giving a first vaccine, COVID vaccine in the ED, and then scheduling a subsequent appointment for those community members to go to PHMG to get their second one. So that's what I have, and I'm going to turn it over to Shanna.
Thanks, Hill. I think you covered most of it. I would just add a couple of things. We may have to steal Peace Island's ice cream truck idea for some of our ice cream celebrations, so we may borrow that in the future. But we've committed to get back to celebrating. We know that is important to the culture of our caregivers in Southeast Alaska, so we did celebrate our excellent engagement results with ice cream and have some additional celebrations planned in the future, so looking forward to that. Hill mentioned that we've done a couple of different things, but just to kind of re-emphasize, engaging a couple of our multidisciplinary caregiver teams to continue to listen and understand more deeply about the feedback from the survey. So the PTE, or Pathway to Excellence Committee, and our RN Conference Committee are engaging with us to better understand and come up with additional ideas that we will incorporate into our plans. And then our Peace Health Experience workshop was just completed a couple of weeks ago, and we'll be debriefing that next week, and really look forward to, like Hill mentioned, we've got a sneak peek, but look forward to that debrief and incorporating those learnings into our plan going forward. And the last thing I would add around the safety focus is we have already, in addition to the things Hill mentioned, increased the hours of our security presence and heard really good feedback from our caregivers on that. So thank you.
Thank you, Shanna. Thank you, Hill. Our final report is going to come from Elliot Quita for St. Joseph Medical Center. Elliot.
Great. Thank you, Chuck. So many of the themes that you've already heard continue for the St. Joe's cohort as well, but one of the areas that we learned from the engagement workshop was really around the area of staffing and workload. And while I know it doesn't really coincide with the work we're doing this week just because we're so busy and the team has just done, as I said earlier, amazing work, but that is still front of mind for us, and we are really trying to make sure that we figure out how to balance out staffing. The other area in terms of that connectedness and sense of belonging has to do with communication. And so these town halls are a great example, and we just continue to get great feedback from everybody, and we would appreciate your feedback at the end of today's session about the value of these. It's just an opportunity for you to hear what's going on and you know, how we can connect with you so that you know what's happening here in the Northwest Network as well as Peace Health as a whole. Lastly, on the communication front, one of the things we're learning from some of the work that we're doing in our lean transformation work, particularly in our procedural areas, is the importance of precise and concise communication between the PHMG medical offices and our procedural areas. And so as we do work from a lean perspective in, say, the OR, we're learning that we need to sort of migrate up into the clinic setting to make sure that what's being communicated from the office in terms of the needs of the patient, the needs of the surgeon, that is getting into our schedulers and into our system here so that we can proceed smoothly, efficiently, and effectively from a process perspective. So stay tuned there. Those were things we heard from you as part of the engagement session or the sensing sessions. And so we are working on those items very diligently. Thanks, Chuck.
Thank you, Elliot. And I think that as I listen to all of the updates from the various communities regarding what we heard from the Caregiver Experience Survey, I simplify it in one quick phrase. Your feedback becomes our action plan. So we will continue to work to solicit further details, further understandings about those things that are most important to you. Clearly, safety and security came out as a key theme across all of our 4 communities, and we'll continue to work on that. On another light note here, there is a shout out in chat today. Cherie Benson really called out the vaccine clinic at the Health Education Center in Bellingham. And that clinic is going to be winding down. Vaccine demand has dropped to a point where we believe that it can be effectively managed at the Cordata site for PHMG. So we will be transitioning the Health Education Center, which is a wonderful element of success. Speaking about some of the lean learnings that Elliot mentioned earlier, it really was the culmination of many, many, many great minds thinking about how we can put vaccines in people's arms as efficiently and as quickly and as compassionately as possible. And I think that we've just heard just wonderful, wonderful recognition for the clinic. So to read Cherie's comment, I would like to give a round of applause to Chris Gajero and the Cordata team for the remarkable job they've done running the clinic. Such professionalism, kindness, empathy, humor, and their incredible ability to juggle 20 things gracefully at a time. While I am only a witness to this, I have never been so proud of working for Peace Health. Cherie, thank you so much for adding that comment into chat. And we are just so proud of everyone's vaccination efforts and reaching out into our communities. Another question that came up from chat or from an advanced question was, well, gosh, what are we going to do though for some of those communities that perhaps are not as high of a vaccination rate? Those who might be vaccine hesitant or marginalized because they've had limited access to good health care. And what are we going to do? And we actually have been doing quite a bit. For the past 12 weeks, we've been doing continuous community outreach. We've done 19 focus clinics in Bellingham, really relying on various advocacy groups, community groups that already are reaching into those communities, sometimes with language barriers, sometimes with transportation barriers. And we have done a variety of ways to reach into as many corners of our communities as possible. I know those partnerships have existed in all of our communities, but that's just one example. We think that access to the vaccine is a very important health equity issue, and we continue to try to find ways to reach out to our communities that can't come through the normal traditional pathways. But since I've talked a little bit about vaccinations, I have two subject matter experts on the line this morning. And the first one is Raymond Bellarmino, who oversees our infection prevention services for the Northwest Network. And Raymond, a question came in advance about the recent CDC guidance and what that means for us having to wear masks inside our Peace Health facilities. So I'm wondering, Raymond, if you could give us the latest interpretation.
Yeah, happy to. Thanks, Chuck. So I'm sure most of us are aware by now that the CDC eased recommendations regarding masking for fully vaccinated individuals in the general public. And that's the key point, it's in the general public. In that same update, the CDC specifically noted that the updated recommendations do not apply to healthcare settings. So we're still operating under our respective state requirements and standards. So with that, our universal masking and physical distancing strategies will remain in place. We do have a work group at through System Incident Command that is continuing to evaluate these changing recommendations from the CDC and any updated state requirements. So really looking at those updates and implications on our policies and practices within our healthcare settings. So just a final point on that is we just ask and really plead with all of our caregivers to just remain vigilant both inside and outside the workplace. You know, we need to continue to push through and remain diligent in our practices. Thanks, Chuck.
Thank you very much, Raymond. And I think the other thing that's so important is really the effectiveness of the available vaccines. And so our other subject matter experts is Dr. Penn Barnes, an infectious disease provider. And Dr. Barnes, I've got a couple questions that came in advance about the COVID disease, the vaccinations. But maybe just to start off, is there a little bit of background and a little bit of state of the state you'd like to give regarding COVID-19 today?
Thanks, Chuck. Yes, I think that we are at a point now with the COVID pandemic, and it is still a pandemic, and it remains a pandemic. And that was one of the questions that came up. And it will do so because if you think about it, Africa is not going to get vaccinated till the end of 2022, they think. And what happens when you have unvaccinated countries is what's very, very sadly happened in India right now. As far as locally, what is happening is we likely have the B117 variant, which is the UK variant. And what we have seen is a very sharp change in demographics of people who are coming into the hospital. So we have 25 and 35-year-olds who are coming in, and that's quite sick. And basically otherwise well. So we weren't seeing that last summer, and this is what has been happening with the variants all over the world. The variants are also up to 75% more infectious. So having a family gathering, while we may have got away with it last summer, people who are unvaccinated are getting sick, and we've had whole families in the last few weeks. The vaccine works, and it works incredibly well. We are not seeing people coming into the hospital who have been vaccinated and who are very sick. What is very interesting is actually talking with some of the younger people, the 20s and 30s, is that they are not anti-vaccination. It's just that for them, COVID has been a disease of the elderly, a bit like MIs and strokes are, and it's never crossed their mind that they might be able to get COVID. And I've got one patient who has, on Friday, his entire family and his entire workplace are all going off to get vaccinated because they felt that COVID didn't really relate to them. So I think that the first thing is that the vaccine works, and everybody, the outreach we're doing that Chuck talked about, but we can also do a lot by telling people that it does really matter, and the vaccines are keeping people out of hospital. The other variants that are around, that there is the Brazil variant, which is the P1 variant, is a variant of concern because it can cause severe illness and death in people who have previously had COVID. They saw this in Brazil, and this is why having the concept of some people not getting vaccinated is that I've already had COVID, or I think I've already had COVID and therefore I'm protected. If you get the P1 variant, you may well get very sick indeed. And the city of Manaus in Brazil was a classic example of this, where they did a study and 60% of people had what I call old-fashioned vanilla flavored COVID last summer. They can tell from the blood bank serologies. And a lot of those same people got the new variant, the P1 variant, at Christmas, and sadly got very sick, and a lot of people died. So the vaccine is effective against it, though. So please, everybody, get vaccinated and keep talking to everybody about what's going on and the fact that the vaccine, it is startling the fact we have not seen people who are vaccinated coming into the hospital.
Thanks, Dr. Barnes. And a few takeaways that I heard. So number one, if someone believes that they've had COVID before, or they have had COVID before, still get vaccinated. It helps boost your immune system and protects against the new variants, and that we have effective vaccines against the new variants. Number two, that our caregivers are beginning to ask, well, we've heard rumor that there might be a need for a booster shot. Do we know anything definitively yet about whether we'll receive booster shots for those of us that have already been vaccinated?
Thanks. We don't, but we anticipate that will be the case. And it will probably have boosting against the variants. The other thing to know is, and it will probably be in the fall, the flu shot is going to be absolutely critical this year as well in the fall, because there is emerging data from last year when flu was still around, from spring 2020 or late winter 2020, that flu plus COVID is a much more lethal disease than either flu or COVID alone. So looking for the booster shots and looking for your flu jab in the fall is going to be critical.
Yes, and if there's one theme to take away from this, the vaccines are effective. The vaccines protect people from severe disease, and we still don't have enough people in our communities yet vaccinated. So please You are all influential leaders in your families, your friends, and in your broader community. Please help us get the message out and encourage others to receive the vaccine, precisely for the very, very good reasons that Dr. Barnes has already shared with us. I'm just going to take a quick scan and chat. I'm not seeing any new questions at this moment regarding vaccines. Thank you so much, Dr. Barnes. It's really wonderful to have you and Raymond as subject matter experts and available to us. Thank you again.
Thanks.
Okay. Karen, if you would be so kind to pull up the slides. So in a previous town hall, I received the question about, well, is peace healthy following all of this COVID pandemic? And at the last town hall, I talked a little bit about, yes, we're doing okay, but we're still very much in our recovery mode. So I thought I would share with you a couple graphics. And so first of all, for those of you that perhaps don't have a finance background, EBITDA is called earnings before interest, taxes, depreciation, and amortization. Or as the way I like to think about it is, well, how much cash is left at the end of the day that we have available to reinvest in our organization? And so we use EBITDA as a measure of available funds after we take care of all of our patients. We receive reimbursement or lack of reimbursement. We cover all of our expenses, and then that is the remainder that we have as a not-for-profit organization to reinvest back into our organization. We do not have shareholders, we do not pay out profits, and so that is why we look at this as a measure to get a sense of how healthy we are and how we're able to reinvest back into our physical buildings, our clinical equipment, etc. So what I thought I would do is just really talk a little bit about where we are. And so 2019 I would describe as a normal year. And so that is our baseline year, and that's the first bar in the graph. The second fiscal year is 2020, and that was the majority of the year where COVID really hit us, and it hit us extremely hard in March and April. And then we spent the entire summer and the remainder of the year on our recovery journey. And so there was pent-up demand for healthcare that came back. We began to start taking care of surgical procedures, getting people to start getting through their elective cases, and just the ongoing needs of sometimes deferred healthcare needs. 2020 was a challenging year, but we worked super hard to keep our caregivers and our family intact. So if you remember, we had caregiver protections for people whose regular jobs were impacted. We used those individuals to then help out in other areas across our medical centers. So we did not do any caregiver employee reductions in force. We didn't lay anyone off. And we really did our very, very best to give protection, job protection, as well as pay protection for a period of time. Once we got back into our regular recovery mode, we then went back to those normal things that we do to keep us as a financially viable organization. And so we focus on productivity, we focus on throughput, we focus on patient access, and really making sure that our processes are as efficient as possible. We also know, though, that our economy has still been impacted. But when I look at our fiscal year 2021 performance, which we're still in the middle of right now, and that will close out at the end of June, we are 90% where we were compared to the baseline year, which is impressive, which is amazing, which is a sign of our ongoing strength and stability. So from that perspective, we are able to reinvest back in our organization. Next slide, Karen. So reinvestment typically means how we spend capital. And as I said earlier, that's clinical equipment, investing in our buildings and infrastructure. So in 2019, our base year, we reinvested $33 billion back into Peace Health and the Northwest Network. In fiscal year 20, we still reinvested an amazing $29 million back. One of the reasons that that slowed a little bit was that we weren't able to execute on as many construction projects as we normally would, precisely because of the restrictions and a reduction of people in and out of our building to do work. But then this year, fiscal year 21, we have approved approximately $39 million of capital, projects underway, projects that will come to completion within the next 6 to 9 months. A tremendous amount of reinvestment back into the organization. I want to thank each and every one of you for your collective efforts, which enable us to do that and to stay a healthy healthcare organization. Next slide, please, Karen. And so this gives you a sense of what our various categories are. The gray bar is what we would describe as strategic. So those are often new programs, new pieces of clinical equipment, creating new services that we didn't have before. The orange bar are the facilities, so those things that are related to construction, new buildings, and other upgrades. And then finally, the blue bar is clinical equipment. So that could be a portable X-ray machine, that could be a new CT scanner, and those types of examples. And so as you can see, in fiscal year 21, we have a lot of work to do. We have lots of investment in our property, plant, and equipment. Next slide, please, Karen. And so finally, here's just a quick list of across all of our 4 communities, some of the capital investments that we're making. This is just the top of the iceberg. There are, I would say, probably hundreds of capital projects and new pieces of clinical equipment being deployed across our Northwest network. In addition, the Peace Health Medical Group has 2 significant building projects underway. There's a women's health clinic, which is here in Bellingham, which will be bringing all of the services from Cordata South to a brand new clinic setting just on Birchwood, very close to the hospital. So it'll be easier for providers to come and take care of the OB/GYN patients. In addition, a very important investment in the community of Linden in North Whatcom County, the North Whatcom Clinic. And both of those are expected to break ground and commence work this fall. And then I'm just going to take a quick look at the chat here for a moment. Karen, if you could just drop the slides now. So will there be a staff reduction to help recover? No. Our goal is to just stay with our efficient processes that we have now. It's very normal for you to have conversations with your manager about efficient staffing, if there's not patient volume, folks to go home early, and things like that. So we're going to stick with our normal processes that have served us well. Krista, thank you very much for channeling my inner CFO, because you are my teacher. Let's see. And then Jose asks, are we going to build another hospital since we have been full lately? Yes, yes, and yes. So not another hospital, but we are currently in pre-construction design for a new pavilion. And that new pavilion will be an addition to the St. Joseph Medical Center. It's designed to create additional beds so that we can convert as many of our semi-private beds as possible to private. We would also have an increase in our bed count, and then the ability to surge within that newly expanded building. Secondly, it will take our current ED department, which is not very efficient, and it's bifurcated between the north and south towers, and bring it into a new modern emergency department, one singular department with single patient rooms within that emergency department, as well as including CT and general radiography embedded within the department. And then finally, having our child birth center fully reimagined. So not only taking care of the patients that we serve today, but being able tomorrow to be able to take care of a more complex mother as well as a more complex newborn. Our goal is to keep more of our moms and babies in Whatcom County. We have great physicians, great nurses, great clinicians, and we believe that we are capable of doing more. We just need to bring the physical structures up in place to support not only more labor and delivery rooms, more postpartum rooms, but also taking our special care nursery and really upgrading it to a full NICU. And then finally, taking our pediatric patients, which are currently being served on an inpatient unit elsewhere in the hospital, and integrating them in an adjacent location. So, and then Jose says, might as well get a second magnet. Okay, more diagnostic imaging. That's a good suggestion. Thank you. The other question that came in, oh, there's one last question here. I notice the stairs trailers remain here. Where are we in connecting the sterile processing instrumentation issues? Elliot, I'm wondering if you wouldn't mind taking that answer because you know the specifics around that, like the back of your hand.
Sure. So the Steris trailer is in place, and we've actually put it into full production just this week. We have started one of the big capital projects that we have going on, close to over $9 million worth of spend, is in replacing all of our SPD equipment downstairs, the cart washer and the instrument washers. And so that work has begun, and it's created the need for us to have operations in 2 locations. We're still able to operate downstairs in a confined space, but we also are using the trailer. So Chantel and her team are just doing an excellent job. We did have to staff up that department in order to be able to have work going on in 2 places. Yesterday, we had a very busy day in the operating room, and the team just did a fabulous job of keeping up with all of the instrument sets coming down and being cleaned and sterilized in 2 places. So we're going to be in this condition for several months. We are expecting the work in SPD to be completed sometime in early February. So stay tuned, but thankfully we've got a great crew of people down there doing work, and Chantel and Carla and others are really making sure that our patients are safe and that our surgeons are able to keep doing their cases.
Elliot, thank you so much. And the stairs trailers are an important component for us to have the ability to safely do the upgrades and enable us to continue at our normal capacity while we take certain pieces of equipment offline and replace them. So the stairs trailers, as Elliot said, will be here for a little while longer. It's because we've got a lot of work that we're undertaking. We have time for one last question. I'm going to speak to one that came in advance. And it said, the question was, what is Peace Health doing to become a more LGBTQ plus friendly workplace? And it's a very timely question. June, which is traditionally Pride Month, is just right around the corner. Peace Health has a number of caregiver affinity groups, and I'm wondering if Jennifer from colleagues out there, if she could help put that full list of caregiver affinity groups in chat, I would be so grateful. But in recognition of Pride, I'm actually going to be meeting with the Pride Caregiver Affinity Group this Friday, tomorrow. So that we can actually think about not only brainstorming for this year, but also for next year's Pride celebrations. For all of our caregiver affinity groups, for all of our caregivers, for our patients, really just having visibility and awareness that there are other people like us, whatever that us may be, within Peace Health is just so important. But then along with that assembly, you then have the ability to get direct feedback and insight at how we could do a better job as an employer. Jack, could I ask you for just maybe a 1-minute summary of the Diversity, Equity, Inclusion Steering Committee that we have inside the Northwest Network?
It takes almost a full minute to say that.
Jack, drop your headset, please, your mic.
Oops, is that better? Sorry about that.
Much better. Thank you.
Sorry. Thank you. So over the past year, we have put together what we are calling the Diversity, Equity, Inclusion Advisory Council out of to be able to be a resource for all of the leadership and subsequently all of our caregivers as it pertains to all issues within the Northwest Network surrounding diversity, equity, inclusion. And we have members on that council from all 4 of our facilities in the Northwest Network, and we meet routinely and and we're working alongside with the System Diversity Inclusion Office as well. We have system members on that team. So more will be coming out about that probably in another month. We have a leadership meeting coming up that will present present exactly what we're doing and how we're getting involved. We do want to hear from our caregivers how we can get involved in the community in these efforts and be more visible surrounding the topic. So,
Jack, thank you so much, and I appreciate your leadership as you carry these topics across the Northwest Network and engage. So we are right at the 45-minute limit of our meeting today. I want to thank everyone for joining us. As always, please, 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 before you leave, put some feedback in chat. Let us know how we can make the next Caregiver Town Hall even better. I want to thank you all for doing such amazing work in the Northwest Network. We have been busy and you have been rising to the occasion. So thank you very much. I want you all to take care of yourselves and be well. Thank you again.